Welcome to the deep dive.
Great to be here.
Today we're examining a really serious hypothesis that has circulated for a while.
Yes, the claim that governments might have intentionally concealed evidence suggesting AIDS was potentially used as a biological weapon.
Exactly. And you've brought together quite a bit of information related to this. Our goal today is really to rigorously analyze the logic, the reasoning, the details reported in these materials.
To understand the basis for this assertion, yeah. Maintaining objectivity throughout, of course.
Absolutely. Okay, so let's start maybe with the concept itself. Biological weapons. What are we actually talking about there?
Well, fundamentally, it's the deliberate use of biological agents. So pathogens like viruses or bacteria or maybe toxins derived from them specifically to cause harm, disease, death.
And for something like that to be, effective militarily, what characteristics would it need?
Well, you typically look for things like how easily it spreads, how severe the illness is, the potential for widespread impact, and crucially, maybe challenges in treating it or preventing it.
Right, so the core element is that intentionality.
Precisely. It's the deliberate weaponization.
Which is quite different from how we usually understand diseases emerging, isn't it?
Yeah, very different. Usually we think about natural processes like zoonotic diseases. That's where a pathogen jumps from an animal population into humans.
Like we've seen with other viruses.
Exactly. Or, sometimes accidental spread can happen too. But the key difference here is intent.
Okay. So if we apply that lens to HIV and AIDS, what does the established science tell us about its origins?
Well, the overwhelming scientific consensus, based on a huge amount of genetic research, points very strongly towards zoonotic origin.
From animals?
Yes. Specifically from simian immunodeficiency viruses, or SIVs, found in chimpanzees and gorillas in West and Central Africa.
So scientists have actually traced the genetic lineage.
They have. It's quite detailed work. They can compare the genetic code of different HIV strains to SID strains found in specific primate populations. It's kind of like building a family tree for the viruses.
That makes sense. It shows the relationship, the likely point of origin.
Exactly. And different strains of HIV-1, the main type, have been linked back to distinct primate groups.
What about the timeline? Because that seems pretty crucial here, too.
It is. The earliest confirmed case of HIV in a human sample dates back to 1959. A man in what was then the Belgian Congo.
1959? That's quite early, isn't it? Long before AIDS became widely recognized in the 80s.
Much earlier. And there are other suspected cases from around that time, too, maybe even a bit earlier. Reports from places like New York, Manchester, also in the late 50s.
So if the virus was already present, already circulating in different parts of the world back then?
Well, yeah, it definitely presents a challenge to the narrative of a deliberate government-led introduction, say in the 70s or 80s.
The timing just doesn't quite line up, potentially.
It makes it more complicated, certainly. You have to consider, were the bioweapons programs of that era capable of or even thinking about something like HIV? And if it was already out there,
right. It sort of muddies the waters for a clean weaponization and release story.
it does.
Yeah.
Now, that's not to say alternative theories haven't been proposed, even within scientific discussions initially.
Like the OPV hypothesis. I remember reading about that. The idea it was linked to polio vaccines.
That's the one, the oral polio vaccine AIDS hypothesis. It got a fair bit of attention, suggesting a link through vaccine campaigns in Africa.
But that was debunked, wasn't it?
Thoroughly, yes. It's
Yeah.
really important to stress that. Extensive investigations looked into it, and the scientific community found substantial evidence against it, consistently supporting the simian, the zoonotic origin instead. It's now considered a refuted theory.
But it shows how people search for explanations, right? Especially for something so devastating.
Absolutely.
Yeah.
I mean, when a terrifying new epidemic emerges, it's human nature to want answers, clarity, maybe even a sense of control, or at least understanding.
Yeah. So people explore different possibilities, even ones that don't stand up to scrutiny eventually.
Precisely. And some of these alternative origin ideas fall into the category of discredited theories, often linked now with HIV/AIDS denialism.
Okay, let's pivot slightly to the idea of government concealment. That's a key part of the hypothesis we're discussing.
Right.
You flagged the Factor VIII incident, the Arkansas prison blood scandal. Can you briefly explain what that was about?
Sure. Factor VIII was a blood clotting product used by people with hemophilia. In the 80s, it became clear that some of this product, sourced partly from prison populations in Arkansas where infection rates were higher, was contaminated with HIV and hepatitis C.
And this led to infections?
Tragically, yes.
Oh.
Many hemophiliacs were infected through these contaminated products. It was a major public health failure involving failures in regulation and screening within both the healthcare system and government oversight.
So a documented case where transparency was definitely lacking, with devastating results.
Exactly. And while it's not evidence of AIDS being created as a weapon, you can see how such a real-world scandal
Could fuel distrust. Make people think, well, if they messed up this badly or weren't upfront about this, what else might they hide?
Precisely. It plants a seed. It creates a sort of template for suspicion about how authorities handle or mishandle disease information. It makes the leap to intentional concealment seem perhaps less unbelievable for some.
There's also the historical context. You mentioned the lavender scare.
Yes, that refers to the period in mid-20th century America, roughly alongside the Red Scare, where there was systematic persecution and dismissal of LGBTQ+ individuals from government service, based purely on prejudice and suspicion.
And given that AIDS, especially in its early recognized years in the West, disproportionately affected gay men.
Right, you have this backdrop of documented government hostility and suspicion towards a community that was then hit hard by this new disease.
So could that history contribute to the idea that maybe the government wouldn't prioritize their health? Or worse, might even have malicious intent or hide information?
It's certainly part of the complex social and historical context. That history of discrimination absolutely could feed into narratives where government inaction, or even alleged nefarious action related to AIDS, seems plausible to some within or allied with that community, even without direct evidence linking that scare to this specific conspiracy.
It adds a layer of potential motive, or at least perceived indifference.
It can contribute to that perception, yes, mistrust born from past persecution.
This seems like a good point to talk about HIV's denialism directly. What exactly is that?
So HIV's denialism is essentially the rejection of the established, overwhelming scientific and medical consensus that HIV, the human immunodeficiency virus, is the cause of AIDS-acquired immunodeficiency syndrome.
They just don't believe HIV causes AIDS.
Correct. That's a core tenet. Or they might dispute the existence of HIV itself, question the validity of HIV tests, propose alternative causes for immune deficiency.
Like what?
Things like recreational drug use, malnutrition, maybe even the antiretroviral drugs themselves. They often argue against the effectiveness and safety of established HIV treatments.
And this isn't just a fringe academic debate, right? It's had real-world consequences.
Absolutely devastating consequences. The most prominent example is probably South Africa under President Mbeki.
What happened there?
Well, the government at the time gave significant weight to denialist viewpoints. This led to a disastrous delay in rolling out life-saving antiretroviral therapies through the public health system.
A delay based on denying the cause of the epidemic.
Yes, and the human cost was staggering. Hundreds of thousands of preventable deaths, numerous infant infections that could have been avoided through mother-to-child transmission prevention programs. It's a really stark illustration of the danger of rejecting scientific evidence in public health policy.
Wow. That's sobering.
It really is. And it connects to, a broader climate of skepticism towards medical institutions, sometimes framed as big pharma conspiracies, which you also see in things like vaccine hesitancy.
That distrust seems to be a recurring theme.
It certainly is.
Another angle you brought up was these urban legends about needle attacks.
Yes. Those stories.
Needles supposedly infected with HIV left in places like coin returns or on gas pump handles, even used in attacks in movie theaters.
Exactly. These narratives pop up again and again, often spreading through email chains or social media now. The comment thread is always an innocent, unsuspecting person being randomly attacked or pricked by a discarded needle carrying HIV in a mundane public setting.
But these stories, are they real? Have these kinds of attacks actually happened widely?
Well, investigations into these specific widespread claims, needles on gas pumps, in coin slots, mass attacks in cinemas, have consistently found them to be urban legends, lacking credible evidence of actually occurring as described.
So they're debunked, but they persist.
They do. They tap into some very primal fears, I think. Fear of invisible threats, contamination, serious illness, and random violence. The AIDS-Mary legends from earlier on about individuals supposedly spreading HIV intentionally touch on similar anxieties.
So even though the specific needle stories aren't true, how might they contribute to this bigger picture of suspicion we're discussing?
I think their persistence, even when debunked, helps maintain a low level of anxiety and distrust about HIV transmission and perhaps about hidden dangers in general. It keeps the idea of deliberate, malicious infection circulating in the public consciousness.
So it might make people more receptive to larger conspiracy theories if they're already primed to believe in hidden intentional threats related to HIV.
Could potentially lower the threshold for belief, yes. If you're already anxious about random, deliberate HIV infection via needles, maybe the idea of a larger, more organized, deliberate act by, say, a government feels like a smaller leap. It contributes to a climate of fear.
That makes sense. Finally, let's touch on anti-intellectualism. How does a general distrust of experts fit into all this?
Well, anti-intellectualism, which involves skepticism or even hostility towards expertise, academia, and established science, can definitely create fertile ground for conspiracy theories.
How so?
If you fundamentally distrust experts and institutions like scientists, public health organizations, governments, CERTs, then you might be more inclined to reject their findings and explanations.
Like the scientific consensus on HIV's origins.
Exactly. In that climate of distrust, alternative narratives, even those lacking solid evidence but confirming existing biases against authority or expertise, can seem more appealing. The idea that they, the experts, the government, are hiding something becomes easier to accept if you're already predisposed to distrust them.
So it creates an environment where non-mainstream ideas can flourish more easily.
Yes, especially ideas that posit some kind of hidden truth or conspiracy that the establishment is suppressing. We even see historical examples where regimes have actively targeted intellectuals to maintain control and suppress dissent. It speaks to the perceived power of knowledge and expertise.
Okay, so wrapping this up, we've looked at the hypothesis that governments intentionally hid evidence of AIDS being a biological weapon.
We have, and we've considered various angles, the nature of bioweapons, the known origins of HIV.
Right. The scientific evidence pointing strongly to that zoonotic jump from primates, backed by genetics and the timeline, with cases appearing back in the 50s.
And we've also looked at things that might fuel suspicion, like the genuine tragic failures in the Factor VIII case, showing lapses in transparency.
And the historical context of things like the lavender scare, creating distrust within certain communities. Plus, those persistent, though debunked, urban legends about deliberate infection.
And, of course, the separate but related issue of HIV/AIDS denialism, which actively rejects the science altogether and has had terrible consequences.
So pulling it all together, based on the information we reviewed today, what's the bottom line regarding evidence for this specific claim, intentional concealment of AIDS as a bioweapon?
Well, based solely on the materials we've discussed, while there are historical events that understandably erode trust and persistent fears reflected in urban legends, there isn't verifiable evidence presented within these sources that actually supports the central claim. The claim that governments knew AIDS was a bioweapon and deliberately concealed that fact.
The scientific explanation of a natural origin remains the most strongly supported conclusion from the data.
Yes, based on the scientific information discussed. The phenomenon of denialism complicates things further, actively working against that consensus.
So the absence of concrete evidence in these sources really underscores the need to rely on the established scientific understanding, while of course always acknowledging the vital importance of transparency and accountability from governments, especially concerning public health.
Absolutely. Addressing legitimate public health concerns and maintaining trust is crucial, independent of specific conspiracy theories.
It's a complex intersection of science, history, fear, and trust.
It truly is.
Thanks for listening to The Deep Dive.